everyone. My name is Andrea Gale. I am a registered nurse practicing in geriatric care. I work as a nurse manager on a long-term care unit in a nursing home facility. I am also a graduate student at Roberts Wesleyan College, where I am pursuing a master's degree in nursing leadership and administration. My presentation today is on how interprofessional collaboration is essential to the provision of healthcare in the 21st century. This will be highlighted in a project that I'll be attempting to implement in my place of employment. The concept of interprofessional collaboration is based on utilizing communication and collaboration to provide safe and effective care. Characteristics of collaboration include accountability, communication, leadership, discipline, coordination, having a clear purpose, and having a strategy in place. Better healthcare collaboration has been alluded to a key approach to healthcare reform. Improve patient outcomes such as reduced preventable adverse drug reaction, enhanced medication dosages, and decreased morbidity and mortality rates have been identified as results of collaboration in healthcare. Collaboration by healthcare providers affords them benefits in the form of decreased extra work and increased job satisfaction. It is important for professionals to be thoughtful of how patients and team members are involved in the decision-making process. It is also of equal importance for professionals to be mindful of how communication and collaboration between the healthcare team and the patients are affected by current social and spatial structures. Interprofessional collaboration optimizes patient outcomes by improving communication and teamwork. It also supports coordination of care across healthcare in all settings through working as a team. When nurses and other professionals collaborate as equals, patient outcomes care tend to improve. The ECRI Institute, formerly known as the Emergency Care Research Institute, created a list of the top 10 patient safety concerns for healthcare in 2018. This list details issues of significance to healthcare, such as new risk, current issues changing due to technology or care delivery models, issues that need focused attention or present new opportunities for intervention. All of these 10 patient safety challenges pose significant healthcare concerns that emphasize the need for interprofessional collaboration in the delivery of 21st century healthcare. However, the three concerns that are applicable to my project and practice area are internal care coordination, incorporating health IT into patient safety programs, and patient engagement and health literacy. When care is poorly coordinated, patients are at risk for events such as medication errors, lack of necessary follow-up care, and diagnostic delays. Failure to communicate contribute to these risks. Providers include multiple specialists who must inform one another at every step in the care process of the patient condition, medication regime, and medical history. Utilizing handoff tools help to establish a standard process and ensure that important information is communicated. The use of checklists and huddles help with effective communication also. Whenever there are multiple providers and specialists involved in a patient's care, it is vital to communicate to ensure ideal care coordination. It is essential to have communication training and leadership support in care coordination to foster teamwork amongst the various providers and specialists and quality care outcomes. The role of the nurse leader is to advocate the value of nursing in care coordination and transition management. Incorporating health information technology into patient safety programs can essentially help to improve the safety and quality of healthcare. However, users must possess the ability to recognize, react to, and report health IT-related events for analysis and action. Facilities should focus on integrating health IT safety into the existing safety program, collaborating with stakeholders, and embedding health IT safety into the organization's culture. Nursing leadership in healthcare organizations should implement cultures that embrace health IT safety and effectively utilize it in the daily workflow to enhance the benefit and reduce the risk. Having relationships and partnerships is essential to manage their health. It is imperative that patients be engaged in their healthcare, and the healthcare team should ensure that patients' healthcare needs are met. The healthcare team should involve patients and families in identifying, planning, analyzing health literacy, and patient engagement initiatives. The healthcare team should ensure that all material and discussions are easy to understand. A key step is eliciting patients' goals and connecting them with recommended actions. All these strategies require collaboration of the interprofessional team for optimal results. Nursing leadership in healthcare organizations may also collaborate with other entities, such as government agencies and community groups, to address determinants of health in order to meet patient health needs. As a member and a leader of the interprofessional team, nursing look for areas in need of development, utilizing teamwork, collaboration, best available evidence, and communication to improve patient care and the organization. As a nurse leader within a long-term care setting, an area that I identified for development is the implementation of a culture of patient and family-centered care as a way of being in the community of the nursing home. This is an evidence-based change for elders, families, and healthcare staff of a long-term care facility that is developed within the framework of the Plaintree model of person-centered care. This change in practice will require the collaboration of the interdisciplinary team and leadership to lay the foundation of person and family-centered care. The culture of person and family-centered care will enable better relationships between the elders, families, and staff, and allow the elders' dignity and better quality of life, expand the focus of care to embrace multidimensional interventions and treatments that support the elders' holistic well-being. Essential to the ongoing oversight and coordination of the envisioned change will be the establishment of a cultural change committee comprised of the nurse manager, representatives from residence council, family members, members of the interdisciplinary team, and other staff members. Other members of the interprofessional team essential to the success of this change are the administrator, the chief nursing executive, the director of nursing, the associate director of nursing, the finance department, the IT department, education department, the nurses, the CNAs, the doctors, the nurse practitioners, the social workers, resident enrichment specialists, dietitians, MDS nurses, families, and elders. Pulling all these members of the interprofessional team together supports nursing practice that place the elders and families at the center of care, which is the essence of how nursing is practiced. The interprofessional collaborative approach promotes a joint effort on behalf of the elders, with a common aim from all team members involved in the care. Collaboration and teamwork makes it easier as the interprofessional team embrace person-centeredness because the focus of care is the same. Nurses are valuable members of the interprofessional healthcare team as they openly participate in caregiving relationships and collaborations that allow them to share in health conditions and provide critical interventions that embrace wellness promotion as part of healing. This enables the nurses to utilize knowledge and skills to collaborate with not only the healthcare team, but also the person and families. In the environment of teamwork and joint effort, nurses are change agents for working with the interprofessional team in full person and family centeredness. Collaboration that will take place in the design, coordination, and evaluation of the patient-centered outcomes of a person-centered care are the Director of Education and the QAPI committees will review and approve the evidence presented in the literature to implement the change. The ADON will be involved in reviewing, amending, and approving the evidence-based change. The Chief Nursing Executive will review, amend, and approve the change. The Administrator and the Finance Department will approve the change, provide funding resources, and implement policies. The nurse educator will be involved in conducting educational sessions for the nurses, while the CNA educator will be conducting education sessions for the CNAs. Both groups of educators will be involved in educating the interprofessional elders and families. The nurse manager and the LPN clinical coordinator, along with the interprofessional team, will be involved in implementing the change on the unit. All the disciplines will be involved in being compliant with the change. The IT department will approve and update all components added to the electronic health records. The QAPI committee will monitor implementation and track changes. Collaboration is an important component of team processes that require competence, confidence, and commitment on the part of all parties. Communication strategies that will be utilized to develop, participate, and lead the interprofessional team in the implementation of a culture of person and family-centered care are utilizing self-assessments and presenting case study of patient and family in long-term care, evidence-based information acquired through literature searches, plain tree model of care, and clinical practice guidelines to communicate the need for the change. Incorporating family and person into the vision of the community through careful planning with the interprofessional team, elders, and families. Communicating for buy-ins through QAPI meetings, huddles, staff meeting, and in-service education. Empowering action and removing barriers by engaging adequate resources and skill. Staff recognition and progress reports in QAPI meetings, huddles, and staff meetings. Consistent education and evidence to demonstrate persistence through continued relationship building and educational opportunities for elders, families, and staff, and reviewing admission case studies to establish where improvements are needed. Evaluating progress through biannual employee and family surveys and sharing outcomes with elders, families, and staff. Routinely scheduling care plan meetings with the elders and families will provide the opportunity to reflect and collaborate even more. It is important for the interprofessional team to contribute specialized knowledge and skills and communicate effectively to address healthcare needs of the patients. In summary, collaboration is key to the success of any team. Collaboration by the interprofessional team is necessary for the successful implementation of a culture of person and family-centered care. When healthcare professionals assume complementary roles to work together and share accountability for problem solving and decision making, there is improvement in quality and safety in patient care. Interprofessional collaboration in healthcare alludes to sharing, partnership, power, interdependency, and process. Interprofessional team members should be able to use strategic communication to provide important input and information that contribute to the delivery of team-based care and enhance health outcomes. Interprofessional collaboration is mutual collective action geared towards the common goal of improving the quality and safety of patient care. It enhances coordination and communication, and thus, in turn, improves the quality and safety of patient care. As demonstrated in this presentation, communication and collaboration helps in improving patient safety and quality of care. Diligence in interprofessional collaboration fosters good communication and increase opportunities for enhanced clinical outcome in the delivery of 21st century healthcare. you everyone for viewing my project. I hope it has been informative, and I have a good night.